Hello, everyone. This informational recording is intended to provide additional support to applicants who are responding to the request for applications for service providers as part of the Back at Home Balance of State program. This recording is taking place on June 20th, 2023. Please note that if you have additional questions about the RFA process, you may send them by email to housingstability@ncdps.gov. That's housing, HOUSING stability, STABILITY @ncdps.gov. Next slide, please. My name is Catherine Castleman, and I'm a Planning and Policy Manager here at the North Carolina Office of Recovery and Resiliency. I'm joined today by Brian Alexander, Project Director for the North Carolina Coalition to End Homelessness, also called NCCEH. NCCEH staffs the Balance of State Continuum of Care that operates in 79 counties across North Carolina. Next slide. In this recording, we'll cover the program background and overview, instructions for applying to the RFA, as well as the timeline and next steps. Next slide. First, we'll cover some background and history on this initiative, as well as the new rehousing program. Next slide. The Back at Home initiative is a collaboration of state and local partners. Back at Home Balance of State is administered by the North Carolina Office of Recovery and Resiliency with assistance from the North Carolina Department of Health and Human Services and the North Carolina Coalition to End Homelessness. NCORR will serve as the oversight agency for this iteration of the Back at Home initiative to administer grant funds from multiple funding sources, assist with reporting and reimbursement, contract for and manage funding sources to provide financial assistance and supportive services, ensure match requirements are met, and assure compliance and adherence to best practices. The North Carolina Coalition to End Homelessness is the collaborative applicant for North Carolina 503 Balance of State Continuum of Care. They will provide oversight as the COC to Back at Home Balance of State and will support service providers through knowledge and skill building activities, technical assistance, and compliance support, including support utilizing the Homeless Management Information System, or HMIS. Next slide. The Back at Home North Carolina initiative provides an infrastructure utilized by multiple programs. Because Back at Home is designed for common activities that stabilize people in housing, the infrastructure can be used for programs with distinct purposes and related funding sources. Each program under the initiative has a defined target population and geographic area. As of 2023, 3 projects are under the initiative. First, Back at Home Disaster, which operated from September 2018 to June 2022. This inaugural program under the Back at Home North Carolina initiative was launched in 22 counties in response to Hurricane Florence, and it offered rapid rehousing to assist households who were unable to exit disaster shelters and who were ineligible for other disaster housing assistance programs. After the disaster shelters closed, the program expanded. Back at Home CV operated from August 2020 to September 2022. This program provided similar services and built on the infrastructure that was established by Back at Home Disaster to quickly expand rapid rehousing services and rental assistance statewide. The program operated in 83 counties and 3 continuums of care. In addition to these communities, elements of the Back at Home infrastructure were utilized by 3 other continuums of care in 5 counties. Back at Home Balance of State is currently slated to launch in October 2023. Seed funding for this version of the program was obtained through a successful grant application to the U.S. Department of Housing and Urban Development's 2022 Continuum of Care Special Notice of Funding Opportunity. Back at Home Balance of State is focused on serving people experiencing homelessness with severe service needs in 79 counties within the Balance of State Continuum of Care. Next slide, please. NCORR will contract with two types of key partners to provide assistance to households and support the implementation of back-at-home balance of state. One is a centralized financial assistance administrator, and the other is service providers. NCORR will serve as the oversight agency for this iteration of the Back-at-Home initiative to administer grant funds from multiple funding sources and contract and manage funding sources to provide financial assistance and services, ensure match requirements are met, and assure compliance and adherence to best practices. NCCEH is the collaborative applicant. They will provide oversight to back-at-home balance of state and will support service providers through knowledge and skill building. The Housing Collaborative, based in Charlotte, North Carolina, has been selected to serve as the financial assistance administrator and a core housing navigation partner. While financial assistance has been an essential element of the Back-at-Home initiative since its creation, how financial assistance is handled will change under Back-at-Home balance of state. To minimize the administrative burden on local agencies and the program administrator, the program will centralize financial assistance. The Housing Collaborative will make housing-related payments on behalf of the program, including application fees, background check fees, deposits, and monthly rent and utilities. Service providers will be selected through this RFA to provide 4 types of housing stabilization services in a defined geographic area. Service providers will reach out to severe service needs households in unsheltered locations and shelters not participating in the COC's coordinated entry system. As households are identified, case managers will work to ensure that they're in a safe location while they make housing plans and connect them to permanent housing resources through coordinated entry. At coordinated entry, participants may be assigned to the Back-at-Home balance of state housing programs or to other housing programs. If the household is assigned to Back-at-Home balance of state for permanent housing, the service provider will continue to provide services to the household to find a unit and support them in staying housed. Service providers will also connect households to broader service systems to access healthcare, mental health, substance abuse, employment, and benefits services. Next slide. Back-at-Home balance of state will centralize grant administration, reporting and financial assistance, provide a monthly service provider payment, and use a rehousing support team model, as well as braiding together multiple funding sources at the state level and leveraging other housing resources. This initiative will build on lessons learned from previous iterations and provide a structure that allows for monthly per household payments. So ultimately, other sources beyond HUD funds will be used to support the program, and we hope to use the lessons learned from previous iterations to create a successful program. I'm going to turn it over now to Brian.
Thanks, Catherine. The initial phase of the Back-at-Home balance of state rehousing program, built on the money awarded through the special CUC program NOFO, will be 3 years, starting in October 2023. By braiding the funding from the special CUC program NOFO, as well as funds leveraged from other sources, the program intends to serve approximately 2,600 households through a combination of housing stabilization services to navigate the homeless and housing system, to access permanent housing through the CUC's coordinated entry system, to offer different levels of financial assistance to households to maintain their housing, and support them through connections to healthcare services and other needed resources. These funds will be available to households who need services in any of the CUC's 79 counties. The program's focus is to serve people experiencing unsheltered homelessness or with histories of unsheltered homelessness with severe service needs. To support households experiencing homelessness with severe service needs, the program will follow a rehousing support team model or team-based case management model. Team-based case management refers to a collaborative approach that provides comprehensive and coordinated care to households in a housing crisis. It involves a diverse team of professionals who work together to address the unique needs of individuals to provide holistic support. Team-based case management is an approach that engages a multidisciplinary team who collaborate to assess, plan, implement, coordinate, monitor, and evaluate the options and services required to meet an individual's health and support needs. This team-based model recognizes the complexity of crises that households experience and acknowledges that addressing these issues requires a comprehensive and integrated approach. The team typically includes professionals from various disciplines, such as mental health professionals, social workers, and peer specialists, who bring their unique expertise to the table, centering services on the households being served and promoting improved outcomes that enhance the overall well-being of the household. For this program, teams will consist of at least 2 members that can collaborate and support one another. NCORR will prioritize larger teams covering larger geographic areas, meaning applicants should consider information in the RFA that justifies the team size for which they are applying. To ensure that staff on teams have the capacity to provide robust services to the population of focus, the program will target a ratio of 1 staff person to 25 households. Understanding that each member of our housing team will work with households with varying levels of needs, the ratio will be applied to the team and each staff member. For example, the rehousing team consists of 3 members, meaning the whole team will be expected to serve 75 households across the team. However, within the team, 1 team member might have households on their caseload that have extremely high needs, with a mixture of people living across several counties and in various parts of the process, some housed and many others unhoused. This staff person may only be able to serve 20 households on their caseload, whereas the other 2 staff members on the team have households concentrated in one area of the geographic service area and all established in permanent housing. These 2 staff members have 30 and 25 people on their respective caseloads. This allows flexibility within the team to assign cases based on current and future capacity, but give the agency the ability to assign cases to team members based on the needs of the households being served. To support rehousing teams, NCORR will be contracting with the North Carolina Coalition to End Homelessness to provide ongoing support to agencies funded to perform this work. As part of NCCH's role, staff will provide hands-on support, helping agencies to understand and implement best practices, address emerging and ongoing challenges, and focus on evaluation and performance management. After the selection of regional service providers, NCORR and NCCH ground and the types of supports to be provided. Selected regional service providers for the Back at Home Balanced Estate program will provide 4 levels of service to comprehensively meet the needs of households experiencing homelessness with severe service needs. This array of services aims to meet households where they are and assist them to connect to and navigate through the system of care to access their needed housing and service needs. Rehousing support teams will engage households while experiencing homelessness, assisting them to connect to local services and interim housing while helping them navigate the coordinated and other systems to access and move into permanent housing. Rehousing support teams will work alongside households as they transition into permanent housing and provide ongoing services as needed while housed to stabilize to maintain their homes on a long-term basis. The 4 levels of service that rehousing support teams will provide are outreach, housing stabilization case management, system navigation, and housing navigation. So let's take a moment to define what each of these services mean to agencies looking to apply to become a rehousing support team in the program. Outreach services assist in the location, engagement, and support of households experiencing homelessness with severe service needs with life-saving resources. Rehousing support teams will be expected to locate households experiencing unsheltered homelessness, engage households who are not currently being assisted by the homeless service system to determine needs, explaining the system and how to access resources. Rehousing support teams will provide life-saving resources such as food, water, clothing, blankets, and other necessities as acts of humanity and compassion, and as a means of developing trusting relationships and rapport. These teams will act as a street outreach resources for people experiencing unsheltered homelessness, assertively and proactively engaging people where they live or gather, responding to calls from the community identifying households who are unsheltered, regularly checking in with system partners such as librarians, school liaisons, parks and recreation staff, and others to identify new households experiencing unsheltered homelessness, and coordinating support for households experiencing unsheltered homelessness during extreme weather and other disasters. Housing stabilization case management services create a partnership with households to assess, plan, implement, coordinate, monitor, and evaluate the needs of the household to get and keep housing. As part of housing stabilization case management, rehousing support teams will work alongside households to create and implement a housing stability plan to obtain and maintain housing, assist with budgeting and providing financial counseling for housing and living expenses, provide financial literacy and budget basics education, connecting to other resources such as community-based consumer credit counseling bureaus, support households in the development of independent living skills, assist households to reduce the risk of eviction with conflict resolution skills, and provide transportation to assist with obtaining and maintaining housing. System navigation services assist households with accessing resources from the homeless and partner systems to get and keep housing. As part of the system navigation services, rehousing support teams will assist households to obtain safe interim housing if desired while working on longer-term housing plans, obtain necessary personal documentation required for housing applications or programs, refer and provide warm handoffs to needed services available in the community, including DV services, veteran-specific services, behavioral health, healthcare, and first responder services. Identify potential eligibility for benefits and resources, complete referrals and applications, and provide warm handoffs to housing programs outside of coordinated entry, including public housing authorities, Target Key, HOPWA, and other local housing programs. Social services to help with finding housing necessary to support meeting medical care needs, and programs providing income benefits such as SSDI, veteran disability benefits, employment programs, vocational rehabilitation, and others. Complete CE assessment requirements, ensuring households are placed on the by name list and serve as an advocate during case conferencing meetings. Assist households to complete annual or interim housing recertifications, and refer to legal support to address needs related to finding and maintaining stable housing. And housing navigation services. These assist households to gain access to and address issues with maintaining a physical unit. Rehousing support teams will assist households to address any barriers to obtaining housing, including eviction history, poor credit, and criminal history. Assist households to select adequate housing and complete housing applications, including supporting with background checks and other required paperwork associated with a housing application. Complete reasonable accommodation requests. Coordinate household moves into stable housing by assisting with logistics, utility setup, and obtaining furniture and housing supplies to support stable housing. Connect to or provide households with education on tenants and landlords' roles, rights, and responsibilities, and assist households to identify housing preferences and needs. Now I will turn it back over to Catherine to talk about what to expect when awards are made.
NCORR has received a letter of award from HUD that indicates that the organization will receive approximately $22 million to rehouse individuals who are literally homeless and have severe service needs in the 79-county balance of state continuum of care. The grant term is 3 years and is anticipated to begin in October 2023. Service providers will contract directly with NCORR to provide services, and the payment structure is a per household per month fee of $400.26 per household, which is based on the fee schedule for the Healthy Opportunities Pilot Program operated by the North Carolina Department of Health and Human Services. NCORR will work with NCCEH to establish a quality review and performance management process based on the contract for housing stability services with each organization. The total number of service provider contracts will depend on geographic coverage that can be provided by applicants across the 79-county region, as well as the number of clients each organization can serve. HUD grant terms and conditions are forthcoming and are expected in summer 2023. Service providers will need to check back frequently on the RFA posting page to see if there are updates on additional materials that will be required for application to this funding source. As mentioned, other funding sources may be incorporated into the program in the future, but the payment structure will remain the same. Next slide, please. Now we'll talk through some specific application instructions. Next slide. To be eligible, an applicant must either be a nonprofit organization, a unit of local government, a public housing authority, or a Native American tribal organization. All applicants must submit a financial management policy and conflict of interest policy for finances to meet the threshold for review. A template for financial management policies is provided with the application materials on the RFA posting page. Next slide. All applicants must submit the financial management policies to meet the threshold. A template for financial management policies is provided as mentioned. Applicants have to be eligible entities, and nonprofit agencies must be established for at least 3 years. These are the threshold requirements that are required for review of the application. Next slide. The scoring rubric for the application is described in more detail in the RFA instructions document. Priorities for selection, as described by the points for each section, are program geographic coverage and staffing, experience supporting households, and the use of required approaches, as well as the other criteria listed here and in the application. Each section of the application will be scored by a review panel led by NCORR, with a total number of points given for each section of the application. A review process will occur later in July. Next slide. If you have questions, please feel free to email us at housing.stability@ncdps.gov. All questions should be emailed by June 29th, and responses will be posted in one single document on or around July 5th. Next slide. A few notes and tips to assist with your application. Please make sure to read the key terms section and incorporate these into your application narratives where possible. You may use the template policies if you do not already have your own versions of these policies. Priority will be given to service providers that can cover large geographic areas and who can ramp up staffing and operations quickly. Please double-check your final application to ensure that you have uploaded all required documents to the Smartsheet form. Use the application checklist in the RFA instructions document as a guide. Next slide. Now we'll discuss the planned RFA and program timeline and next steps. Next slide. The application period for this RFA started on June 19th, 2023, and the final date to submit applications is July 21, 2023. All questions should be submitted by email by June 29th and will receive responses by July 5th. Review and initial selection will occur between July 24th and August 15th, followed by a notification of intent to fund letter for successful applicants that will be contingent on any additional requirements from HUD in the terms of the grant agreement with NCORR and by NCORR's compliance and IT teams. Final contracts will be set with service providers in mid-September, and training will occur in the last week of September, with program launch on October 1. Next slide. Please feel free to reach out with questions or clarifications that you may need during the Q&A period for this RFA. Thank you for applying to be part of the Back at Home Balance of State Service Provider Network. This concludes the informational presentation. Thank you for your time.